Good morning. I'm Melvin Carter, Mayor of the City of St. Paul, and I want to thank you all for joining us at our beautiful state capitol. And I want to thank everybody who's joining me here, especially Attorney General Ellison, my lawyer. You have always been a strong ally to the City of St. Paul, and I hope to continue our partnership as your office builds off the Medical Debt Fairness Act. Ruth, thank you for being here on behalf of Undue Medical Debt, our national nonprofit partner who has eliminated over $9 billion in medical debt across the country. That's right. Thank you. Since the day I announced our medical debt reset initiative, Ruth, you and your team at Undue have worked diligently alongside our Office of Financial Empowerment to make today a reality. Director Akram Kaliso, Office of Financial Empowerment and Financial Capability Director, Manager Casey Wiedrich in our Office of Financial Empowerment. It goes without saying that we would absolutely not be standing here without your commitment to this work, so I want to thank you as well. And to Walt Myers, who is here with me, Walt, thank you for sharing not only your own story, but also the story of your late wife, Sue. Your experiences serve as a proud reminder of why we do this work and who we do this work for. Today, I'm proud to announce that our first financial relief package of our Medical Debt Reset Initiative has arrived, and soon 32,000 St. Paul residents will receive a surprise notice in the mail that their medical debts, totaling just shy of $40 million, have been purchased by the city and completely abolished. 5 years ago, we in the City of St. Paul recognized that late fines were keeping people from accessing our libraries. So we went fine-free and eliminated over $2.5 million in existing library debt. As a result, immediate double-digit growth in library use concentrated in our lowest income neighborhoods. We welcomed back 42,000 patrons to our libraries and saw 85,000 total items checked out on cards that had been previously blocked. Libraries are a community resource, and rather than punishing our community, we decided to take care of them. The policy worked. So 15 months ago, during my 2024 budget address, I announced our Medical Debt Reset Initiative, that we would commit $1.1 million in American Rescue Plan funds provided by the Biden-Harris administration to abolish $110 million of medical debt on behalf of our St. Paul residents. Every day, millions of Americans face the impossible choice between paying medical bills and covering their basic needs. Nearly half of all bankruptcies are linked to medical debt, and nearly 50% of adults have delayed or skipped care due to debt. As we saw, the COVID-19 pandemic disproportionately impacted people in communities with lower economic stability, poor access to health care, and higher rates of pre-existing conditions. So if there's one thing the pandemic taught us, it's that if even one of our neighborhoods struggles to access medical care, the health care of our entire community suffers. So let there be no mistake, this is about more than just eliminating debt. This is about eliminating one of the greatest barriers to healthcare access, giving people the chance to take control of their own health. We're proud to do this through a public-private partnership with organizations like Undue Medical Debt and Fairview Health Services. This partnership reflects the difference that can be made when healthcare providers and organizations come together to tackle medical debt and improve community health. It's a win for everyone. And it's just the beginning. We will continue this process with Undue. We are starting with the purchase of the debt owed to Fairview and appreciate the work that they've done with us to get this done. And we will continue to have these announcements as we continue to work with Undue to acquire and forgive additional debt owed on behalf of our residents. Without further ado, I'd like to introduce our State Attorney General, Keith Ellison. Thank you, sir.
Thank you, Mr. Mayor. And let me congratulate you for your bold leadership, for your sensitivity to the problems of the people of St. Paul. And let me say thank you for lighting the way, because there's no reason why this should stop at St. Paul. That's right. There's no reason why this policy should not be extended throughout the state of Minnesota, because Minnesotans, in fact, are struggling under the weight of medical debt. Medical debt they did not ask for, they did not plan for. Medical debt that they did not expect, they could not negotiate the rates of and the terms of. Medical debt that is literally a barrier for them to go seek future care, because when they think about getting that cough looked at, they think, well, I already got medical debt I can't pay, so what am I supposed to do? I don't know. Hopefully it'll get better, but what if it doesn't? It is a good idea to deal with this medical debt burden, and I think that enlightened leadership, sensitive to the needs, the economic priorities, helping people afford their lives and live with dignity, safety, and respect is what this is all about. And let me just say, we're building on something, because last year, our state legislature, through the leadership of Senator Liz Bolden and Representative Liz Breyer, came together and passed the Debt Fairness Act, making sure that we structured debt better so that there was a little better ability to repay. It wasn't ruinous to the debtor and put the creditor in a position where they might actually get some money back one day. It was a good policy designed to make sure our economy was working better than it was with regard to debt. And this particular initiative in St. Paul allows us to move even further forward. So thank you. I want to let you know that this is the kind of policy and leadership that we need. We need it in St. Paul. We need it in Minnesota. We need it in America. Thank you very much.
Thank you. Thank you. There we go. Thank you, sir. And I'd like to introduce Walt Myers. Thank you for being here, Walt.
Thank you, Walt.
Thank you, sir. Absolutely.
Thank you, Mr. Mayor. Good morning. My name is Walt Myers. I'm a lifelong resident of Minnesota and a father of 3. I'm a U.S. Army veteran. I'm a cancer survivor, and I'm a volunteer at Cancer Legal Care. So this is really a big deal. I mean, it affects so many Minnesotans in need. And today, 32,000 Minnesotans will receive $40 million of medical debt relief, and more to come. I have great empathy for these Minnesotans because I know what it's like to be under a cloud of medical debt. 5 years ago, shortly after my wife Sue passed away from her 23-and-a-half-year battle with breast cancer, I began to receive medical bills from my insurance company for her in-house hospice care. Initially, I wasn't concerned because I knew that my medical policy had a $4,000 maximum out of pocket that I was fully prepared to pay. But as the bills kept coming, the total cost began to far exceed the maximum out-of-pocket dollar amount that my policy said I should owe. I became worried. I had no idea what was going on. I had no idea what to do about it, and I had no idea where it would end. I just knew that I kept getting more bills wanting more money from me. It just didn't make any sense. At first, I tried to deal with it myself, and I called those who I thought might be able to help me. And while most everyone was sympathetic, no one really knew what to do, and no one was able to help me. And I became increasingly worried and increasingly stressed, and I felt very lost in the medical billing hell that I found myself in. Fortunately, I remember a seemingly random comment a social worker made to my wife and me at the cancer center, where she would go for treatment every 3 weeks. And the social worker told us that, if we were in ever need of legal services, there was this organization called Cancer Legal Care that provided free legal services to cancer patients in Minnesota. And I remember thinking at the time, well, why would I ever need something like that? So I called them, and I was put in contact with Bill, their insurance expert, and together we explored ways to deal with what had become a unexpected six-figure medical debt. With the help of my former employer, we came up with a possible solution that we thought might work. We contested the charges, and then we waited. After almost a month of waiting, we heard back from the insurance company with what ultimately turned out to be $135,000 of medical debt had been entirely forgiven. Every penny, it was gone. I was stunned, and I was incredibly relieved. And I don't know how else to describe this, but to me, it was a life-changing event. Sometimes I wonder where I would be today if I hadn't remembered that random comment from the social worker at the cancer center so many years ago. And I suppose I would still be making monthly payments on a six-figure medical debt that I actually didn't know. So today, let's celebrate the good fortune of the 32,000, Minnesotans who will receive medical debt relief. And let's recognize all the hard work that those who made it a reality for those people. And maybe as a result of all of this, we'll be able to hear a few more life-changing stories. Well done, and thank you.
Thank you all.
Mr. Mayor.
That was beautiful. Thank you so much. Introduce Ruth Landé from Undue Medical Debt. Thank you for doing the work.
Thank you. And you can tell I'm not a real Minnesotan because unlike these tough guys, I need to wear a hat when it's this cold. So I'm really honored to be here. Yes, my name's Ruth. I'm from Undue Medical Debt. Let me just tell you how this works. We are a really unique national nonprofit. We use donated dollars to buy up large portfolios of unpaid medical bills and we use the leverage of the size of the amount we're buying we pay pennies on the dollar for that debt. And then we send out letters to people telling them that their debt is gone. The only qualification for help is income-based, so we check and make sure that the person has income that is 4 times the federal poverty level or below, or the debt is more than 5% of their income. That's the only qualification. And so far, actually the number's a little bigger than, it keeps going up. We're getting so much support and doing so much work. So far we have gotten rid of $14 billion with a B, in debt for over 9 million people around the country. So and sadly there's a lot more to go. Thank you. We know that this isn't the solution to the problem. We need to deal with the debt that's already there. And policymakers and leaders all around the country, state and federal, are the ones who can help change the landscape going forward. We know that people need to have affordable, comprehensive insurance so they can seek health care without fear of the consequences. I think the previous speakers spoke well about that fear. That's really what drives it, which is very bad for your health. And it really affects so many people because even if you don't have debt, you're worried about getting that debt. Almost everybody knows somebody who's experienced this kind of thing. I basically want to thank everybody. I want to thank some specific folks, and Minnesota, I should say, has always been a really generous place for us. There's a faith-based group called The Alliance that's supported us for years in Minnesota. And of course, Mayor Carter helping us in St. Paul was really a leader within the state. Without the cooperation of Fairview Health, we wouldn't be doing this today. So I want to really thank Fairview, who stepped right out in front and has been a great partner to us. I also I'm going to read these things and I'm going to do a call out to the journalists here. So here's a quote from Todd, a Minnesotan for whom we have relieved debt. He said, "I have suffered from heart disease since 2010 and have required some kind of surgery almost every year since. This has caused me to max my out-of-pocket costs for the last 14 years. I've been making payments when I can, but the medical debt seems to grow faster than I can keep up. This gift is a true blessing, and I cannot find the words to express my true gratitude. Thank you." And I will give you one other one, which is from a woman who says, "Thank you so much for this generous, kind gesture. It was such a surprise. At first, I thought it was junk mail. After reading further, I couldn't believe it." So I want to tell you, that's one of our fears, right? We're going to mail out these letters, and what if they don't open them? So for journalists, you have a role of letting people know. People don't always look through their mail, to make sure to look for that. For everybody else, let people know about this program so that people get the relief that we are providing. And thank you very much.
Good morning. Thank you all for joining us here this morning. I'm Ikram Kuliso. I'm with our Office of Financial Empowerment at the city. Thank you, Mr. Myers, for telling us and sharing your story. And thank you, Mayor Carter and Attorney General Ellison and Ruth for all of your dedication to making this a reality for us as well. So today marks a powerful milestone, the abolishment of $40 million in medical debt for 32,000 residents, and many more still to come. The achievement isn't just about erasing medical debt, but restoring dignity and peace of mind for thousands of our families in our city here. Medical debt quietly undermines health, stability, and hope for many of our residents in St. Paul and beyond. And we've heard many stories of families who, despite doing everything right, face overwhelming debt from unexpected medical costs. This burden touches every aspect of our lives, and we all can relate to and know people that have been impacted by this and can have impacts from housing to education, often pushing most of our vulnerable households further into hardship and poverty. Our work of the Office of Financial Empowerment at the city is rooted in the belief that financial health is essential for individuals, and not just individuals, but for our overall community well-being. Initiatives like College Bound St. Paul, our guaranteed income, promoting worker co-ops, and also initiatives like this now with medical debt provide an opportunity for us to work holistically and have that approach to financial justice to serve our St. Paul residents. We know that when families are financially secure, our entire community flourishes. I want to thank our partners at Undue Medical Debt, Fairview Health Services, and everyone in the mayor's office and beyond that's championed this initiative. The letters going out to families shortly are not just letters, they're messages of hope and a testament to what is possible when we prioritize our people and our families. Together, we're proving that transformative change can happen here in St. Paul, and we hope that today's successes serves as a blueprint for a statewide relief. Let's continue working together on a future where healthcare doesn't lead to financial despair, but rather a healthier, more equitable Minnesota for all of us. And thank you all for making this possible for us going forward.
So as we discussed, 32,000 St. Paul residents this week will receive mail in the next week letting them know that $40 million of medical debt has been purchased and eliminated on their behalf. Happy to take any questions. Yeah, there's no action people need to take. There's no need to apply. You know, it's one of the things that we work really hard on. Many of you have heard me say with regards to, for example, our college savings accounts initiative, when we say that's available for every child born in our city, what we mean is there's an application to not get a college savings account when you have a child born in our city. In the exact same way, because Undue works directly with the healthcare providers, they can access the list of debtors and purchase the debt without engaging directly with the person. So there's no application, there's no action required on the part of the former debtor. It's something that we are a service that we're providing citywide. It's frankly one of the hallmarks, I think, of our Office of Financial Empowerment is that when our teams Casey and Akram and our teams in the Office of Financial Empowerment call families to let them know that we've already started a college savings account for your child, or that your family qualifies for our guaranteed income pilot, or that we've eliminated medical debt on your behalf. Folks do sometimes think it's a hoax because it feels too good to be true. And we're very proud to demonstrate the extent to which our local government can work on behalf of everyday residents and make a difference in our day-to-day lives.
Yeah, I don't have it for this particular one, but it's usually somewhere between 1,000 or 2,000, which is more than the average household has, sitting around. But yeah, but it can range hugely. It can be huge. One of the gentlemen talked about, thousands of dollars, or it could be $500. Big range. Soon, I think, yeah. You know, it's, I used to work at hospitals for years, so I ran billing. Everything, you know, moves slowly, but we have been talking to all the major systems in the area, and yeah, we've got a lot of things moving. So yeah, stay tuned is what I would say.
Yeah, stay tuned. In my budget address last year, we shared that all of our major hospital systems in the state have signed on to do this with us. So Fairview has gone first, and we expect the rest to follow shortly.
Is there a timeline to reach that $110 million goal?
There's not. I don't think there's a specific
think so.
delineated timeline. Obviously, as soon as possible. We have to do the same work with all of the other hospital systems as we've done now with Fairview, and you know, our teams are working hard to be able to do that so that we can send a whole lot more of these envelopes out.
What's the timeline again for people of this first batch? I know you've got 100 letters here today. If you're in this first batch of people, really for the next month or so, you might get a letter, or what do people?
My understanding is the letters will be mailed in the next week.
Yeah, that's
All
my
of those in the
understanding.
next week.
Yeah.
Yeah.
Yeah, we use a bulk mailer, you know. It's,
And just for clarification, all of these letters are from Fairview.
These letters will come from Undue Medical Debt and the City of St. Paul. They are with regard to debt owed to the Fairview system, yes.
Do you anticipate some money in your next budget to continue this, add on to it, depending on how this first round goes?
You know, again, this is funded by American Rescue Plan dollars, which are pandemic relief dollars provided by the Biden-Harris administration. This is not funded by property tax dollars. It gives us the opportunity to reset, to buy all that debt down to zero. Again, as Ruth mentioned, on behalf of residents who make less than 400% of the federal poverty guidelines and or owe more than 5% of their income in medical debt. So this will provide us a reset. So ostensibly, there won't be a necessity for a next round of funding next year. As Ruth mentioned, this doesn't solve the problem. The underlying problems with our kind of global healthcare systems that lead to $40 million, $110 million in medical debt in the first place are still problems that we need leaders like Attorney General Keith Ellison and the legislators he mentioned to help us resolve at the state capitol, and we need leaders in the federal government to help us resolve. This gives us a reset in St. Paul so families can breathe a little bit easier, so families can know, like I said, if eliminating library debt resulted in double-digit increases in library use in our lowest income neighborhoods. We're really excited about the freedom that eliminating medical debt will allow us to go to the doctor and get the types of preventative care that we all deserve.
Mr. Myers, a question for you.
Question for you, Mr. Myers.
Okay. Thank you.
What's it like for you to be standing up here today, just taking a look at this box, knowing that this type of help is coming from other people to maybe, when you were in a similar spot?
It's life-changing. I don't know how else to describe it. My wife just passed away. I was dealing with all of that, and then all of a sudden this unexpected six-figure medical debt came, and it doesn't have to be a huge amount like that. It's whatever helps the person, but there's no other way to describe it. It was absolutely life-changing for me to have that medical debt resolved, and I could get on with my life. So I would expect that it will have the same effect on 32,000 people when they get that letter in the mail. It's very cool. So I'm proud to be a part of this, and thank you. Sorry.
So every letter is a surprise, right? Can we talk about why that works and why that choice to have this be a surprise? You could be contacting all these people individually, or just, people who applied for this, or, talk about that.
One of the things that we're well aware of is oftentimes when we create programs that we design to help low-income Americans, oftentimes we require those folks to prove that they're low-income Americans and, bring this and bring that. And the eligibility criteria, the application process, ends up being the hurdle that keeps people from accessing the aid that we know that their families deserve. And so one of the things that we look for, and again, we've done this with regard to college savings accounts, we've done this with regard to a number of the different types of resources that we've brought online with the city, is systemic ways to identify the residents who need the help in the first place, so that we're not just helping the folks who have the quickest access to the internet, we're not just helping folks who are sitting around, watching a TV or sitting in front of their computer when we did the press conference. We get a chance to literally all of our low-income residents, everybody in our city who makes less than 400% of the federal poverty guideline or owes more than 5% of their income in medical debt. We get to wipe it clear for all of them. We don't have to stop and take time to say, hey, do you want your medical debt wiped clear? I think I'm confident what the answer would be. We don't want to ask people to jump through hoops to prove that they deserve to live free of medical debt. This is something that we are considering a public resource. That's why we're doing it this way. It won't be a surprise to them that they owe that debt. It'll be a surprise to them that they don't owe it anymore. And I think that'll be a welcome surprise.
I'm happy to take an off topic when we're done.
Yeah.
But can I just add on to this? So go back to that example of the person with the cough who owes $2,000 in medical debt.
That's right.
They're like, I can't go to the doctor because maybe I don't know. I know I can't pay, and I already got debt. So that person gets on the bus, and they keep coughing next to somebody else.
That's right.
Or they go to the restaurant that they work in, and they're washing dishes because they gotta work. They need money.
That's right.
So this is a public good. This actually will enhance the health of the entire city for people who don't owe a penny. So it is a generally positive thing which will have radiating effects throughout the city and state. And if we did even more, we'd get even more benefits.
That's right. We should do it statewide.
I think that's an idea.
Thank you all for being here.